First and foremost with a virus, there is no cure. So it's all about symptom management. We can't give you a quick fix, unfortunately. So the basics of treating a virus include things like decongestants. So medicines that you'll see like Sudafed, so pseudoephedrine or phenylephrine are decongestants. And those medications can help with the congestion in the nose. There are oral medicines and there are nasal decongestants. They can make your blood pressure go up. So if you do have high blood pressure, just be aware if you're using a medicine that has these products in it, it could elevate your blood pressure even more. Also with the nasal spray, we don't like you to use it more than a few days because it can cause you to become more congested over a long term and make you continue to use the nasal spray. So after 3 days, you should probably quit using the nasal decongestants like Afrin. There's also medicines that are cough suppressants like Dextromethorphan or the DM that you'll see on the package label. If you're using medications like Dextromethorphan, I would always recommend to increase the water intake. Also, they seem to work better at night because that's when most of us have the drainage down the back of our throat and we're more miserable. So I usually recommend using products with DM at night. Also, you can use expectorants, so medications that help you cough up the mucus or the congestion in your chest. The most common one that we see is guaifenesin, or products that have that in it are like Mucinex. That's a good example. Again, with Mucinex, you want to drink more water while you're taking the pill because it can make things dry up, which is good, but you can't really cough it out or expectorate it if it's dry and thick. You need water to moisturize it. So I would always encourage my patients to drink water when they're on Mucinex as well. Drink more water. There are some nasal sprays that can help. So just a nasal saline is actually really good. It can keep things moist, can kind of break up some of the stuff in the nose. The nasal sprays like Flonase or Nasonex, those aren't as good for cough and cold type symptoms. You also have an over-the-counter nasal spray called Nasal Crom, which is cromolyn sodium, and it can help with sneezing, it can help with discharge. It won't help with congestion, and it's usually pretty safe. So that's a good option that most people don't think about. So it is important to keep tabs of all the different over-the-counter medicines you're taking so that you aren't overtaking one element or another, especially if you're using the combination medicines. You just want to make sure you're not overdosing, I guess, on those medications. It's really not a concern to have, a decongestant at the same time as a cough suppressant, because that's what the cough and cold combination medicines are. They usually have a pain reliever like Tylenol or ibuprofen. They have a decongestant and they have a cough suppressant in them. So it's okay to take them at the same time. Just be sure you're not taking another over-the-counter or prescription cough and cold medication that has the same elements in it, because at that point we worry about overdosing and side effects.